I think we are now live, right?
I'll just take a second. I'll put my charger close to this.
Yeah. We can start, Dr. Anupama.
Thank you, Rajesh sir, for giving me this opportunity. It's always an honor if I'm asked by Dr. Thank you so much, Dr. Koradia. It's always an honor if you are asking me to give a talk at your platform. It's really an honor for me.
No. I want to correct. It's not my platform. It's our platform.
Yes. Yes, sir.
For namesake, I am here. Baki, we all are participating and contributing equally for on this platform. So it is no more my platform. It's our platform.
Thank you so much, sir. We love you, sir, for that. Okay, so is my screen visible?
Yeah. The trusted healthcare, Dr. Anupama. We can see.
Yeah. That is Patella Hospital.
Yeah.
Okay, so today we'll be talking the ART and Surrogacy Act rules and its implementations. In our recent verdict conference, we had already had a word about this. That was a little bit in a concise form, and today we'll talk a little in detail about these rules. As we all know that earlier the rules there were no rules or act. It was basically ICMR guidelines, which were formed way back in 2005, and we were trying to follow practices according to those guidelines. But later on, the bill was formed once in 2010, then 14, then 17. And there was no clear-cut guidelines for all of us what to follow. And later on in 2021, December, the act was finally implemented and it was published on 20th December. Later on, it was commenced, and that was 25th January. That was the day when the panic started, that stop sharing practices and so many new things which came up. And suddenly on 25th January, I remember there was a big hullabaloo whether we can do the practices which we are doing right now, whether the transfers can be done or not, because our registrations were not done. So as the time have passed, all of us have realized that was just a platform to start these regulations. And the basic reason why that came up was that the government behind the scenes was wanting to curb the surrogacy, all the practices which were actually some practices which were not ethically right. Government wanted to bring them under the law and punishable. So that is why this ART Act first came. And after that, within 4 or 5 days, I think that was 25th of December when surrogacy, that was a holiday when Surrogacy Act actually came over. So the government was so pressed to bring that forward. And so the bottom line which we need to understand is that government does not want us to go about with surrogacy, because in the world platform, it is not seen as something which is right. We might have our disagreements, but this is the truth. And later on, in March, there were few rules which came over. In May, few rules came over, but actually they were not the rules. They were just suggestions from all of us. The actual rules came in 7th June. And that 47-page thing which keeps circulating in our group, it is the one which is actually our Bible, and which I should not say it is our Bible, I would say it is our Gita or Bible or Quran, everything. And all ART rules are to be followed according to that June thing. Whatever other letters you are getting or is in circulation, but which does not have gazetted Indian Constitution logo on it, that is just a suggestion, and we don't have to follow. There were many things like chlamydia test and thalassemia test, but in the final rules, they were all taken out. So they are good practices, but they are not a rule of law. So it is not necessary that you have to follow something which is not gazetted. So later on, after these rules, few more documents came over, and there is a last rule in the act which says that the government can keep on improving and add on new rules according to the need of the hour. And the first amendment which was suggested was that earlier it was said that only 7 oocytes can be taken out from a donor. So later on they said that you can take out all the formed follicles, try not to overstimulate. And the embryo transfer, they said it is only 1 or 2 embryos to be transferred. In special cases, you can put in 3. Later on in October, another amendment came, and that said that affidavits which were to be formed for donors, for third parties, for surrogates, they were earlier to be done only by judicial magistrate or metropolitan magistrate. And later on, the rule came that it can be notarized also and not necessarily under magistrate. And then another amendment came which said that the transfer of gametes, how could it be done? So from one place to other. Earlier in ART Act, there were 18 sections. And now through this 24th February, there was a 19th section which was added. And in this 19th section, there were specifications how, what all forms would be required for transfer of gametes or embryos from one place to other. And there are forms also in that amendment. Form number 16 to form number 24 are there in this amendment. Then in March 23, another amendment came which specified that in surrogacy, there was some thin line which dubious sentence which said that maybe self-gamete can be used from surrogate genetic component. But then they clarified on that 14th March amendment that surrogacy is to be done only by the self-gamete of the couple and not for the by the surrogate. So that has been re-mentioned. Again, there was some ambiguity. So they re-clarified. One more letter was issued on 3rd of May this year, which said that no gamete of the surrogate is allowed for the surrogacy process. And then finally, another amendment came, which was regarding andrologist. Earlier, the procedures like TISA, TC, it was only done by MCH urology. And now this andrology component has extended to people who are doing, who have done reproductive medicine fellowships, or to the MS general surgery also. So that was the new amendments. See, these rules were necessary for one more reason. It is very soon. Now the documentation is going to be so precise with passing time. And within no time, I can assure you that India will be the world leader in ART services. And our data is going to surprise the whole world. And some people who might be saying that we are giving 80-90% result, maybe their false claims would not be the same. But still, I know that in India, the practices are very ethical as well as very financially very sound. We can be the world leader. And as it is through new rules, it is not that the foreigners cannot come to our country for ART services. So maybe whatever constraint we are feeling right now, with passing time, we will all be very busy with our ethical practices. The way of application is that we have to apply either for level 1 or level 2, or if we are doing surrogacy, then we have to separately apply for surrogacy clinic as well. So we can be ART clinic, but if you want to be doing surrogacy services, you also have to apply for surrogacy clinics separately. 2 lakh rupees fees is separately to be paid for surrogacy clinic with the same setup. And for ART bank, again, 50,000 fees is to be paid. That can again be in the same premises, but it is to be applied separately. And earlier there were terms like IVF clinics, but now ART centers, now there's a government designated term for us, and we are all ART clinics, either level 1 or level 2. And if eligible, then we are also ART banks or surrogacy clinics too. Every 5 years, government is very smart. So it is going to, we are supposed to pay fee every 5 years. And for surrogacy clinic, they have made the clause of renewal every 3 years. And appropriate authorities can inspect your premises anytime. And of course, they have to ensure that your embryos or gametes are not to be disturbed, but they can call for any document anytime. Mind you, the online portal is going to go more stronger and stronger. And once the advocate, Ms. Thapar, had told me that right now we are all doing the ART practices and we have started doing the same old thing after 3-4 months slowdown. And now people say that nothing has changed. What is the hubbub about this ART Act and all? But with passing time, the clause of the law will gradually come closer and closer and closer. And one of the ways by these clause and clutches are coming are by this online portals. We will have to mandatorily report our things within no time. I happen to be one of the members and appropriaries in my state, and I know that we are in the process now of making the format for online applications and all. So this is just to suggest all of us that we need to, whatever documentation we are making, it has to be very clear. And whenever the need be to upload the information, we should be. So that is a small suggestion from my part, that we should do our practices in such way so that whenever required, our online portals uploading on.
You're not audible.
Am I not audible?
Now, in between, for a few seconds, you're not audible.
Okay, maybe some signal issue.
Yeah, that's
Right
fine.
now.
That's fine. Yeah, absolutely.
So this is the site on which we have to apply, and the fee has to be deposited. And earlier the fresh applications were not taken, but in my state, recently one advertisement has come in the newspapers that 15 days, again, any center which is doing practices past can apply, but after 15 days, whatever application will be taken as fresh applications. So any one of us who has not applied should apply now within next 10 days probably. This is for Uttarakhand, but states, you should be aware. I'm sure most of us on our portal must have already applied. Okay, so what is the new which has come? And one is that also you can collect the gametes, but it is very important that post-humus collection, consent has to be taken beforehand. So in case of any death, person has to sign beforehand. So usually when post-humus collection time comes, person is already close to death and is not in senses to give consent. So maybe in future time or by Indian movies, this will come up as one thing through which people should understand that they can give their consents for post-humus collection beforehand. Secondly, for minors, their parents can give the consent for post-humus collection. We can freeze these gametes, and the forms are there in the rules by which you can freeze those gametes, and you can extend it even after 10 years if the consent is there. No features can be taken. PGDs are to be done for specific reasons. Out of country, you cannot take the gametes. Insurance is the new clause. Grievance cells are to be kept. No sharing, mixing. Anonymity now is not must. And the banks are the ones who are supposed to keep the data. The gynecologist, even if they are doing IUIs only, they are also supposed to be registered. Earlier, by ICMR, there were level 1A, B, 2, and 3. So now that level 3 has become level 2 ART clinics, and level 1 A, B have been finished, and the level 2 clinic of past has become level 1 ART clinic now. It's very simple now, level 1, 2. The ones who are doing IUI have to register for 1. The ones who are doing more than IUI have to register as level 2. And pathology labs, they cannot register even as level 1 because they need to have a gynecologist. Pathology labs can prepare the semen samples. Director, it is not must to have a director, but if it's there, it is not necessary that the director has to be a doctor. Program in charge, of course, has to be a gynecologist. We are supposed, this is a good practice that we should take disclaimer from all our employees. This is one practice I'm yet to add my SOPs, and it is my suggestion for to do this now, that take oath of secrecy from all our employees. That oath of secrecy was already there in the ICMR guidelines, so you can take a clue from there if voted as a group, but that disclaimer should be taken from all employees. ART banks and clinics can be same. There for ARMs that penalties are due.
Anupam, your voice is breaking. A lot of complaint from everywhere. So please make sure that your connectivity is good.
Am I audible?
Now audible. Yes, yes. In between it's breaking. But that's fine. You can't do anything else because of connectivity, whatever is there. Just make sure then you find out the corner where, I mean, the best connectivity.
मेरे bedroom में बैठी हूँ, वहाँ तो ठीक ही आती है. It's okay. Okay. So I was just saying that penalties should be there for the intending couples also, and not only for the doctors. It should be there for the embryologist or any employees leaking the confidentiality.
Your presentation is gone. Huh? You're not sharing the screen, Dr. Anupama.
I am sharing, sir. So I'll reshare.
No. Yes.
Hold on, sir. It should be visible now.
It's not visible. Now I think, yeah, yes, now it is visible. Absolutely.
Okay. 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 I'll just switch to my mobile network. I think that is the reason why it is behaving like this. Okay. If it happens again, then I'll switch to my mobile network. Okay. There is no such clause as to how many embryologists can be there attached to your clinic. This was one question which was moving around, that one embryologist, one center. No, there is no such rule. One embryologist can be there at 10 places. One doctor can be at many places. Many doctors can be at one place. But the only thing which is important is that while registering, you have to ensure that the whole list is there in your registration application. So you wanted to ask something?
No, because what happens, the full screen is not seen. Can you, take a part of it, because something is the video picture is obstructing the view. Now it's fine. Now it's fine. Now it's fine.
Mm-hmm.
Yeah.
Okay, so there is no restriction to the number of embryologists or doctors, but we should ensure that all of them are registered in our center. And the level 1 clinics can also do the stimulation at their place, but there is no clarity as yet where if they can do stimulation at their place and register and get the pickup done at the another level 2 thing. And as time will pass, we will probably get more clarity onto this. If you would ask me, as an appropriate authority, I would probably allow this, but of course the liability will be there, that of level 2 and not of level 1, because they are the ones who are doing the registration and the pickup of the patient. So general gynecologists should also be aware that if innocence, if they are handling or doing stuff of their of any patient, doing IUI of that patient, they are actually punishable under law. So it is a very good practice to get yourself registered. And this is a very common misconception amongst the gynecologists, that it is okay. And if you are not doing registration, then anybody can take cognizance of this, and then you will be punishable. And if you get a patient who has having, say, 4 million sperm count, and you are letting that patient move around with your treatment, probably you are not doing justified service with your patient. And it is a good idea to refer them to a level 1 or level 2 clinic, as that would be a small window period for that patient. It is also desirable for you to have endotex. There is no specification what should be their qualifications, just an interview. And when you analyze the trainees, and if they are close to 5% to the trainers, then they are acceptable endotex. So the pros of this ART regulation is that illegal players will be going out. I heard that somebody told me way back that in few metropolitan cities, even small teen shade were allowed for, people were practicing in small teen shades and doing ART practices. But probably now with the stringent laws, that will all go off. And the difficult part is that so that is one thing which is of a lot of concern to most of us. Now, if there is a 38 years old female who has been married for 6 months and having regular periods, she has come to a PG gynecologist who is not registered. What will she do? She will probably do a TVS or TSH, prolactin, AMH, and husband's semen analysis. Preferably, she'll get it done from a level 2 clinic, but it's okay, from a pathologist also she can get it done. Now, for a 38 years old patient, that gynecologist should not waste time and refer to a level 1 or 2 clinic as soon as possible for getting benefit to that patient. So it is always better that all the gynecologists should apply. If you are to give good practices, good services to these patients, it is a good idea. You should give up reluctance and register yourself too. And it is also mandatory to issue a discharge certificate to all of those in which you are doing as small a procedure as IUI also. Just a format in which it is written IUI discharge certificate. Whatever IUI procedure you are doing, you are always giving a small record to the patient. Just write a discharge certificate over it. That should be enough as a discharge summary. You need not have to admit the patient for that. Now, another new thing which has come up is that of insurance, and it should be purchased by the intending couple or the intending woman for the donor. And it is to be taken for 1 year, and it is done, it can be routed through the bank, but it is to be done through the intending couple. For surrogate, this insurance time is for 3 years, and it covers all the postpartum complications also. So this amount
Dr. Nupama, can ART Bank take the insurance for the donor?
You can take it. That's not a problem, but it is to be signed by the commissioning couple. You can just facilitate as an ART bank. But of course, on that certified, that affidavit, the name has to be of the intending couple. You are just facilitating it. That is what we are also doing as an ART bank. We are also getting it done ourselves, but we take charge from the patient and get the affidavit made for the patient.
Yeah, thank you.
So it was one point of a lot of discussion that what amount of insurance should be taken. So I did a lot of research, because in our city, whatever complications, I said that say OHSS happens and we admit the patient. I don't think that my patient would be requiring a cost of maybe 3 lakh rupees or more than 1 lakh rupees. I thought that why not take an insurance simply of 50,000 only, and why not save some cost? But then when I worked around all of this, then I realized that the cost of insurance for 50,000 versus 3 lakhs was not majorly different. And ultimately, I realized why this 3 lakh thing came up. It is the standard now has become that 3 lakh insurance is being done, but it is no rule anywhere. Whatever amount insurance you think is good enough for your city, that much amount of insurance is fair enough. But it's ultimately the responsibility of the intending couple that whatever expenses happen for the treatment of the donor, if she happens to need some treatment, then that intending couple has to bear it. So that is why intending couple should be made clear that you are, in this affidavit, it is written that you are going to cover everything. So on safe side, we are getting an insurance cover for you. So you want to say something?
Currently what is the premium?
I think it's
what premium are you paying?
Somewhere around 4,000 to 5,000. Exact amount I'll let you know. It's somewhere around that amount.
And life has to be covered along with the health or not?
No, this is another question which came up, and I was just going to clarify on that. It is not mandatory for life insurance to be there, but whatever insurance we are doing, they are actually giving life insurance along with that in the same amount. So we are taking it, but it is not required. No, it is not required.
Are any insurance specifically designed for this purpose, or it's a general insurance only?
The insurance which we are getting done is the one through which Indira IVF people had suggested. I found out locally, and I found that was the most cost effective one. Edelweiss or something, that name is there. I'll share the number, and probably that is the best of the lot.
See, on Verdi Group, if you can share the copy of that insurance,
yes,
then it will be absolutely fine for us.
Absolutely, sir. I will share that. And I'll share the number of the person concerned also.
Please make a note in your personal notes that please do not forget this. Huh? Please.
Nobody will let me forget, sir, in the Verdi Group. Okay, so another thing was that in the Act, it is mentioned that insurance has to cover the implications of her donation. And say, supposing the donor's husband kills her, or she dies in an accident, then it is not the owners of the bank or the clinic. So it is only the negligence or the medical complications which we are covering. So we should not be scared of the fact that somehow if the woman dies, it is going to come on the bank or the clinic. No, it is not there. It is only the medical thing which we are supposed to cover. Okay, so now about the qualifications. This, I think, is very clearly mentioned. All of us who are already doing the practices before this law, it is very simple. Otherwise, after that, you have to have the qualification of the fellowship along with the 3 years experience. And if you are done a fellowship, super specialty, still that 3 years work experience is required. And for a counselor, any graduate in a psychology or nursing or life sciences is okay. For embryologist, again, the persons who are doing it before the Act are allowed. Otherwise, all the graduates with minimum 4 semesters, 3 years experience, or PhD with 1 year experience, all of them are allowed. PG in biotech with 1 year training with 4 year experience. So all that is allowed. One-time measure is with all this with 500 lab procedures. Now this lab procedure can be pick up as well as freezing as well as transfer. Everything is included in the lab procedures. Anesthetist is to be a PG. So the only 4 things are required. That is gynecologist, embryologist, anesthetist, and counselor. That's it. Optional ones are director and andrologist. All of us know that director can be any non-doctor also can be a director if you want to. It is not mandatory to have a director. Andrologist nowadays, if there is no urology person in your city, it is okay to have an MS gynae friend along with you to cover you. And
Dr. Anupama,
ji,
I am not disturbing you in between.
nahi sir, boliye.
As a counselor, can we employ our one of the assistant gynecologist or RMO?
Yes, RMO, it is important that RMO cannot be BMS. I faced this. One of my RMOs was a BMS, and that was not allowed when I had applied for ICMR. So this is what they told me, that BMS is not allowed. So one of my nurses came up, and then I had to make her my counselor and not a
So
BMS.
qualified nurse can be a counselor.
Yes, yes.
That's great.
In simple BSc, one of my girls who had done a BSc, so that was also eligible. So I had put two names, and one was a nurse and the second one was the BSc girl. The BMS one, the senior one, was rejected actually.
Excuse me, madam.
Yes.
Madam, BA psychology can also be as counselor?
Yes.
Okay. BA with psychology as a subject.
Psychology as a subject, a graduate in psychology. Yes, it is. It
Yes,
is.
yes, I think yes.
Yes, ma'am.
Okay. And as time passes, probably this counselor thing will become more important. Now, probably we doctors are not having enough problem because we have team of nurses with us. So it will not be a big thing for all of us. Some of the nurse will always be there as a counselor. But these things keep happening, that one nurse would get married and another one comes. So try to make a stable nurse as your counselor, at least on paper. Okay.
Another question comes in my mind, Dr. Anupama. There are a lot of fresh gynecologists. They keep requesting about the joining fellowship and issuing certificate of 15 pickup. Now, the whole system. So you have to mention the name of the patient for which they have done pickup. So in the rule, is that specified that the whole pickup was done by him, or can we share one patient for two fellows? That question keep coming in my mind.
Sir, मेरे भी दिमाग में ये बात आई थी. The thing is that one thing is that the ultrasound machine on which the fellows are working with you, they also require the registration. So probably you cannot do. Maybe you have applied for those fellows along with you. Then it's okay that their name can be entered. But in our case, like I have applied only two doctors' name in on my ultrasound machine. So even if the fellows are coming with us and doing pickup, I will probably, and I'm actually training them, but probably I'll not be able to show that. So that is a problem for me as a trainer. But the thing is that if you are a certified center for granting fellowship, you should get their names also added to it, and only then you will be able to add their names in your logbooks. Otherwise, logbook entry is one thing which is very important and which is one which will be scrutinized later on. So that name entry, the person who's doing it or not doing, you are doing or your fellow is doing, it is immaterial. What logbook says is the thing which will be carried. And on logbook, you should mention the name of your co-fellow. Even two fellows also you can mention. Nowhere it is mentioned anywhere, but this is what my mind says, that you can always write the name of two fellows also, but if they are registered along with you.
Because see, recently I conducted the hands-on own pickup program. So in which approximately 7-8 people came. So I registered with the PCP and DT, and separately I told them to, for one day they will be using my machine for the pickup. So please grant me permission. So they granted the permission. So that was for that particular day only.
That's perfect. And you can write their names also, and whatever 7-8 pickups, their name is mentioned on the log, you can very well give it in written also.
Yes.
The only thing which I don't understand and I don't have the answer is whether your fellowship which you are granting, some certification is required for that or not. I am clueless about that, sir. Because I was going through the list for embryologists, where can they get the trainings? Not for the reproductive medicine fellowship, but for embryologist, I was looking around. And one of my friends who gave me a list, that was only 22 centers right now in India, which are actually authorized to give the fellowship for this embryology. So with time, these things have to become more easy. Otherwise, there will be a lot of problem for all of us, because only 22 centers, how many will they produce per year? Maybe 20, 30. So, and the demand is going to increase really exponentially now. So more embryology courses should also be available along with the fellowship of gynecologists.
Then another thing I want to point out, Dr. Anupama, that the centers which are conducting embryology training program, they are not as per the legal provision, as per the new ART Act. We used to train for ICSI, hands-on ICSI, but now momentary we have stopped, because as per the new ART Act, we need to take, we cannot handle the human gametes without permission. It is meant for that particular recipient only. So if you want to handle for research purpose, say, and we are doing hands-on training, that is research purpose.
Exactly.
So if we are doing anything for research purpose, we need to take a permission from the body, statutory body. Then and then we can allow them to handle the human gametes. Am I right? This is my understanding.
Yes, sir, exactly. Probably there need to be more clarity and more platforms to provide the certified courses. That is the need of the hour.
Yeah.
So this is another very common question which comes up. My inspection has been done. I'm still not registered. So what should I should many times, but repeat, you should and registration has not been given, because even if registration has not been given, you are absolutely safe. Nobody will do it. Already doing a, and
your voice is breaking.
As late. Okay, sir. Abhi aa rahi hai awaaz?
Abhi aa rahi, abhi wapas aa rahi.
Let me change my network, sir. Just a second. Why I'm saying so? Because once the registration is given, the thing which I was saying, that claws are closer to your neck, further closer. So don't worry. The other day in the conference, Dr. Koradia asked me, you should we have been in Maharashtra, so that my center would have been registered very fast. I would have given you your last registration, sir, just to ease things for you, because actually you should be happy if the registration process has not been done yet. So we should be least bothered about that. This is one ray of comfort that I can give to all of us. And center by any chance, and your ART level 2 clinic has changed from one place to another. Your lab has shifted from one rented building to another self-building or rented space. What should you do? Unfortunately, you will have to re-register now, because your place has changed. So in new inspection will start off, and that is why you will have to re-register. At the bank, the other day in the conference, Dr. Ashwin had asked me that he has bought his equipments and his stuff is waiting. His application is still there and registration has not come about. And unfortunately, he has started paying the guarantee of equipments is only for 1 year. And that has already started. And probably by 6 months, when his things will be installed, the 6 months guarantee will be lost. So this is an unfortunate situation. So make sure that whosoever is buying a new equipments, you have to tell them that your warranty will start from the day of installation, not from the day of purchase. So this is one thing which I learned from Ashwin the other day.
Ma'am, one doubt.
Yes.
If it's a new center and we have applied for level 2 registration, all the documents are submitted at the state appropriate authority, but they have not come for inspection yet, and it's been more than a month. So are we legally allowed to practice, or should we wait for the registration to come through?
The answer is that when have you applied? If you have applied from the first instance, if it's a fresh application, you are not considered as an old practicing person, then you need to wait. But if you have been doing it earlier, then you don't have to bother. You are already doing your practice, so you don't have to bother about that. But it's a fresh center, then you have to wait for the application.
The center is new, ma'am. I have been practicing before also, but the center is a new center.
Yeah, so the center is new means it's a new center. Then you will have to wait for the registration to happen.
Okay, ma'am. Thank you.
In our state, registration is probably
Yes, yes,
last
please. Go ahead.
inspection is after 3 days. And in our state, most probably we will be disbursing the registration certificate in next 10 days or so. So I think most of the states, it is just in this phase, 10 days or a month or 2-3 months. Probably every one of us will be getting our registrations now. And after that, the real problem will start, which will be of online uploading thing. Well, after that, bank, can it be the same premises? Yes, it can be. It has to be separate entity, and separately registered also. Can ovulation induction and gonadotrophins be used by a level 1 clinic? It is the RTI.
Dr. Anupama, can you elaborate more on the separate entity ART bank? Yes. Can you elaborate more?
Separate entity means that the ART bank has to have a gynecologist as a proprietor who is taking care of the working there, the primary responsible person, and the ART bank has to be another registered medical practitioner. It is a good practice not to have the same person at both the places, because that should be a separate entity. That would be a way easier for all of us. Even your spouse can be the in charge. It is not mandatory that that person should be a gynecologist. So even your son, your friend's son, or somebody who is a registered medical practitioner, a plain MBBS can also be the in charge for ART bank. And the premises can be the same. The equipments which you are using can be the same, but it is a definitely separate entity. So if somebody is asking for inspection, that where is that can where you have stored the semen samples, you should be able to show that separately, that this is the ART bank and here we have stored the semen samples, or these are the separated ones. These are the under quarantine ones, and these are the going to be released ones. And on ultimately, when the online portal entries will come, there will be more problems for ART banks. There is very less work for ART clinics at that point of time, because ART clinics are not supposed to keep all the record of the donors and stuff, but ART bank is supposed to keep all the record. So the reporting which is to be done on online portal, that is to be done separately by the ART bank. Even if you are the same center, the ART bank has to do it separately, and ART clinic has to do it separately, that online entry. And if you happen to be the same center, your things, you should understand that your things should coincide also, because that's a very easy way to cross-check there. And
Dr. Anupama.
Yes, sir.
So we are, suppose ART bank is providing donor to the ART clinic. Now, whether that oocytes drawn from that particular donor are used for some particular patient only, and it is not shared with any other else, it's a responsibility of the ART clinic, right? ART bank, how can they verify whether it has been used for the same recipient or it has been shared with anybody else. So you said that all the responsibility ART clinic need not keep any records on the donor eggs and all those. I think they have to they have to maintain the record that these donors' oocytes are used for whom.
ART clinic is supposed to give the feedback to the ART bank on which couple have they used it and what happened to those embryos. The form 14B, which is the whole detail of day 1 embryo, day 2 embryo, day 3 embryo, all that record the ART clinic is supposed to give to the ART bank. And then the ART bank will maintain that record. So, So ultimately it is, if somebody, the government is to ask what happened to this donor, it is going to ask from the ART bank only. Even if the clinic has shared, if it has done a dubious practice, the bank cannot do anything about it. The clinic has, whatever information the clinic gives, bank will upload that information only.
Suppose clinic doesn't give this information, who is at fault?
Bank has to ensure that they will get, you should not be giving, that's the job of the bank, to get that information extracted from the clinic.
In spite of repeated reminder, suppose they are not giving this information.
So maybe,
because this is practically this is happening.
Exactly. So maybe then on your MOU, you should get it signed. This is just came up in my mind, that ultimately on our MOUs, this should be there, that it is the responsibility of the clinic to give the information.
പണ്ട് ആദ്യം ഹിസ്റ്റക്ടമി എന്റെ അടുത്താണ് പ്ലാൻ ചെയ്തിരുന്നത്. അപ്പൊ അവര് ആശ്രയിച്ച് പോയിട്ട് മറ്റേ ഇവിടെ പോയി ചെയ്തു.
Please mute yourself.
അതിനുശേഷം കുറെ ബ്രേക്ക് ഉണ്ടായിരുന്നു. ഇവരാണ് ഈ ഇങ്ങനെ തന്നെ ഫോർ റെന്റിന് ഉണ്ടെന്ന്.
Please. You please unmute yourself.
Okay. Now I'm audible?
Yeah.
Okay. So that was about the ART bank.
Yeah.
Okay. So can a level 1 clinic use gonadotrophins? Of course, oral ovulogens, no problems at all. Gonadotrophins, can they use or not? There was a lots of hullabaloo about this, and probably one of the first RTIs which was sent to the central authorities after this act came up was this only. And on the answer, there was no clear answer. That was such a dubious answer. Ambiguity was there. No procedure can be called. Answer, you have to be 1, you have to be 2. But if you would ask me as an appropriate authority, I would say it can be applied. But of course, the level 1 clinic has to have a ultrasound machine so that they can monitor whether any complications can arise or not with the gonadotrophin use. The OHSS complications should be scrutinized. And otherwise, why should a level 1 cannot use? I mean, if you want good results, it should be allowed for a level 1 clinic. The gonadotrophins should not be a no for them. And
can you minimize the video picture? Minimize, please.
Okay. I'm going to do that.
Yeah.
Okay. That's it. Next is, can we do FET if a husband is now 35 years old? Sorry, the husband is now 55 years old and is 55 plus, probably 57 years old, and the embryos have been frozen earlier when he was less than 55. So can we still do the transfer? Because actually the embryos were frozen at the right age, but no, the ART services cannot be availed by them now after the age of 55. So that is a very clear answer, that after 55, the male cannot take the services of ART. Say supposing in your clinic, some medico has come up and he's wanting to do a thesis on DNA fragmentation. And you have some discarded semen samples. You have done a semen analysis and there are discarded semen samples. and they want to do a DNA fragmentation on those frozen samples or something like that. You cannot do that unless until you have taken the consent of research from those couples. So earlier, all these things were not questionable, but now this question has come up that even the research has to be done only after the consent of the concerned person. Can the donor be a brother now? Earlier, all these requests we used to shun off, but now this is the only thing which I think is easy now, that yes, we can take the brothers or sisters as donors. And confidentiality is something which we should still maintain. And all known persons now can donate. But the level 1, they say that can they use this brother's frozen sample? So the problem is that level 1s cannot do it because they do not have the storage facility. The level 2 clinics only can do the cryopreservation thing. So level 1s, if they have to have use the sample, it has to be routed through the bank. So it is very important that whatever sample you are using, even if the real brother is there or real sister is there, again, all of them has to be routed through the ART bank only. Can a single woman receive ART treatment? What are all the forms? So any woman who is 21 to 50 years old can take the ART services. And even oocyte freezing also, all of them can get it done after filling the form 10. And if there is a column in form 10 which says that husband section is there. So for single women, it is very simple. Just write it that husband is not applicable. And you cut down this wife word there, and only as a woman you can fill that form 10 and get your eggs frozen. So that is for the social egg freezing. So can the banks also freeze the eggs? Actually, since they do not have the ultrasound facilities and they cannot take the pickups, do the pickups, so that is why they cannot. But it is justified that the bank can act as the oocyte cryopreservation agency too. So,
but Dr. Anupama, the ART bank can act as a ART clinic, isn't it? I mean, pickup can be, they can deal with the oocyte.
Last time in this conference, this was the question which came up. You had said that we are, as a bank, we are also a clinic and we are also a bank. So why can't we do the stimulation and send it?
Yeah.
Sir, I actually looked up after that. The thing is that there is no clear answer to it. And I do not see that you cannot do it. But the common group which we are following, the Indian ART WhatsApp group and the concerned authorities which we keep talking about, still there is no clarity. And they say that ideally the banks should not be doing the stimulation. So I don't have a real answer to your question. I am not against what you are saying, that as an ART clinic you are stimulating and then sending it back to the clinic where it is supposed to do. But actually, as a bank, you cannot stimulate. And as a clinic, if you are stimulating, ideally you should stimulate your own patients. So I still don't have a real answer to it. Probably with time, maybe we'll get an answer to this. Gradually, we are getting answers to many of our queries. So I'll try to
I tell you one thing, what is happening now. Now, ART Bank, every donor agents, they have applied for ART Bank. And by taking service of some fresh gynecologist, they are going to stimulate the donor and make a lot of money out of it. And it is going to be so much haywire because of such unsupervised and improper stimulation. So ideally, you should take initiative in implementing the rule that ART Bank should not stimulate any of the donor. They should be concerned with the providing donor, registered donor, and at the most sperms, nothing else, no stimulation to be done. And stimulation to be done by ART clinic only. If you can influence this in your group, it's better, because I know a lot of agents around who have applied and they're waiting for the permission to receive. And then they think that now they are as at par with ART clinic, and they will dominate all the ART clinics by providing a stimulated donor.
You're right, sir. I agree with you. Yes, I will try to do whatever influence I can, sir.
Yeah.
Thank you. Okay. So where do we get our training? The old ones are okay, new ones, because right now there are not many seats. So still many fellowships which a lot of our hospitals are providing, it is not NMC recognized. So all of us who are providing the clinical experience, that is just a clinical exposure, and probably very soon the NMC will start the fellowship programs in 300 bedded hospitals, or the ones who are qualified. I would, if possible, recommend Dr. Koradia's name as the first applicant.
Thank you. I don't have 300 beds.
I know that, sir. Don't we all, most of us who are into a lot of academics, we are not the ones who will be able to manage 300 bedded hospitals. Okay, so the thing which we have already talked is that PNDT registration is one of the clause of this training program. If a foreigner couple has come for ART services, so it's okay. If they are self-cycles, it's not a problem. Go ahead and do. And if they have come for a donor cycle, and if the donor cycle is with the patient's egg and donor semen is to be taken, again, no problem. But if the donor is to be an Indian donor, then again, it is not a problem. The patient says that they want to get a donor of their own, and that donor is a NRI. And that donor is not even an NRI. It is not from Indian origin. The thing is that whosoever is the donor has to have a Aadhaar number. So that is the gist of the slide, that the bank which is providing service to the foreigner couple has to ensure that the donor which is to be used for this couple has to be having a Aadhaar number. So nowadays, I have realized that any person who is living in India for 6 months, has any document here in India, can apply for Aadhaar card. So that is probably an easy thing for foreign nationals, that if they stay here for more than 6 months and apply for Aadhaar cards, probably they can get their donors also. And then probably we can be able to do their donor cycles as well.
I know some of the agents who changes the Aadhaar card, make Aadhaar card in 1,000 rupees.
Okay. Sir,
In India, everything is possible.
Sir, मेरे 2-3 पेशेंट को उनका नंबर चाहिए. I had a couple. Unfortunately, they lost their son 7 months back, and the wife's age is 48, and the husband's age is 55. The husband really wants to get that changed, because actually they are not.
It's a left-hand job. Left-hand job.
So this is what I suggested them, that this is the only thing which you can do.
We'll talk later.
Okay, import of embryos. Can we do it? No. Earlier, it was allowed for research purposes. Now, even that is not allowed. Import of embryo means you are bringing embryos from the other countries to your country. So there was one rule given in, I have that paper ready in my hand, and that was a clarification from, just a second, I'll read it aloud. So this is a letter, a notification on 20th July 22, and it is from the Director General of Foreign Trade, and the Secretary to Government of India has written that earlier the condition was that the import of human embryo was prohibited except for research purposes. So for research purposes, it was allowed. But now the revised policy condition says that import of human embryo is absolutely prohibited in accordance with ART laws and Surrogacy Act. So now any sort of import, this is very, very clear, is not allowed. Export,
Export.
export means, you are transferring from here to outside. That the whole thing, the new rule which has come in February this year, and the rule 19 which has come up, which is after the application at national portal, you can go about that. It is also said that
Till national portal is formed, is there any way out to export the embryos?
no. This is one thing which they are very, very strict about. And national portal se sir ab ho rahe hain. I just wanted to clarify that one of my patient who happens to be a judge in Uttarakhand, and he wants to get embryos transferred from one other place to our center. Probably they are one of those. He came to me, I think 7-8 months back. And I said that right now we cannot do anything. Let the national portal be established, and only then your embryos will be able to transfer here. So he was one of the instrumental persons who had persuaded. And in my last slide, I have given the address and all. And he has finally got that written thing from the ministry that his things can be transferred. Now, after his persuasion, this rule had also come. This February rule, he had applied before February actually. And this February, now the new documentations, new forms have come up. So we had filled that form. We have given that affidavit also to him that we are ready to accept and all. But somehow the final letter he has still not brought to us. So there is still some locha going on, and I am yet to receive that allowance from the national portal that it is allowed. Although I had filled that affidavit and forms and everything. So, but I think it is under the process, and it's just a matter of few more months and it will be allowed now. Okay. There's another thing which has come up, that you have to discard your embryos after 10 years. And you can discard it earlier also when the patient is stopped paying the annual fees or has given you permission. If this is one question which comes up in my mind. I don't have an answer right now. Maybe with time we'll get an answer. That for semen sample, the quarantine clause had been there. No, it is not mentioned in the new rules anywhere, but as a standard practice through ICMR guidelines, we were practicing this, that the semen sample 6 months quarantine, some say 3 months quarantine is to be done. Now, we are all doing oocyte donor. We accept them happily. They must also, sometimes this might also happen that they are also under window period of HIV infection. And for there, we do not want a quarantine period. But for semen, this is a very stringent law. So I don't think that it is a very palatable idea to be very, very diligent about this semen sample quarantine thing. And I feel that always the fresh semen samples are the things which give us better result in IVF and IUIs. So maybe if at some point of time we would be able to ease it out, me or anybody else in the country, I would be very happy if something like that happens. Of course, the standard tests are to be there, but there is an inherent risk which we cannot just completely ignore. Now, what is surrogacy eligibility? The couples who are to go for surrogacy have to be Indian origin. This is one very important part. They have got to be married, and married Indian couple means a male and a female. So this question was asked somewhere in our verdict group also, and some other friend had also asked me this question, that they have a LGBT, probably a transgender or somebody as a couple had come, and why should we not let them have the ART services? For surrogacy, definitely it is not allowed, but even for ART services, it has to be married Indian male and female. that is mentioned somewhere. In one of my future next slides, I have mentioned that. So here the married couple is to be a female, a male. The age is little different for surrogacy as compared to ART services. The age of female here is not 21 to 50, it is 23 to 50. For males, it is not 21 to 55, it is 26 to 55 on the day of registration. They should not be having any biologically surviving child who's normal. And even if they've had one child by adoption also, then also they are ineligible for surrogacy service. For single woman, it is important that the female has to be of Indian origin and has to be sometime married. She cannot be single, unmarried forever. I mean, she should be either widow or a divorcee. At present, she's single. So a unmarried female who's never had marriage and she has some uterine problems, even if she is in the age of 35 to 45, she is not eligible for the surrogacy services. And of course, she should not be having any child through adoption or surrogacy earlier. So what are the indications for surrogacy services? That she should not be having either a uterus or a severe Asherman or uterine abnormalities or recurrent implantation failures or recurrent pregnancy loss history, and any illness which is making it impossible for the woman to carry the pregnancy. Like, say, supposing she's having a bad preeclampsia history and she's having some autoimmune disorder which is not allowing her to continue with the pregnancy after a certain period of gestation. So that was about the surrogacy eligibility. And the surrogate has to be any willing woman who's ever married. So at present, even if she is unmarried, but she has a child of her own, so even if she is at present separated or something, if she has a child of her own, she can be a surrogate. And we all know that surrogate can be surrogate only once in her lifetime. And the age for surrogate is 25 to 35 on the day of implantation. So what are the various age criteria? The surrogate age is 25 to 35 on implantation day. For
Beautiful slide. Beautiful slide. Very important.
Thank you, sir. For commissioning couple, for surrogacy, the female's age is to be... No, so this is wrong. For couple, for okay, that's I've written in the last. The couple for surrogacy, if they are married, the female's age is 23 to 50 and the male's age is 26 to 55. So what is there in the second line is commissioning couple for
Infertile couple.
Normal ART services. There the age of the female is 25 to 50 and the male's age is 25 to 55, 21 to 55. The female donor age is 23 to 35. So this is one thing which we have to remember, that female donor age is 23, not 21 here. And any female can be a donor. It is not necessary for that female to be married or to have consent of her husband. Male donor, it is easy, same 21 to 55. If there is a single woman who wants services for ART, again, she can take service from the age of 21 itself. And if she's wanting for surrogacy, she has to be ever married and the age is 35 to 45. So how many times the donation can be done? Only once in a lifetime. And sperm donation also can be done. It can be done multiple times, but only for one commissioning couple. And you should get the feedback from the clinic. Say, supposing the patient, you have sent the sample as an ART bank, but the patient did not get pregnant. So that semen sample, if you have that person's semen sample, you can still give to another couple if that first couple has not got pregnant. Earlier, 10 times, 25 times, etc. were the norm. I don't know the exact number, but now it is not the same. So egg donor, again, you can take the service only once in the lifetime. And this is a little unclear whether in the same couple it can be used again or not, but probably the answer is no. And surrogacy, definitely it is only once. But the embryo transfer, if it fails in the first attempt, you can attempt it again up till 3 times, the same surrogate.
So single woman single woman can donate the eggs, but they do not have a right to become pregnant with the help of surrogacy.
They can donate the egg, but
They do not have any right if they are not married to avail the surrogacy service.
surrogacy, yes, surrogacy they cannot. Surrogacy is basically made difficult and difficult, sir. And it is probably assumed that you should get married, at least do that much compromise in your life, get married, and not.
So we will have to find out the agent who have male who are ready to marry and divorce.
बिल्कुल सर, आई एम वेरी श्योर सर, अभी बहुत जल्दी एक आध कोई मूवी बनने वाली है बनेगी जो सारे रूल्स हम सबको समझा देगी, हाउ टू go around and round.
Yeah.
Okay, so what all certificates are to be notarized? Most of the documents in which the services are to be taken by husband wife only, there are hardly any affidavits which are required. But for donor cycles, the couples have to give notarized affidavit for for two things mainly. One is that they would say that they are the ones who will be the child will be getting their legal rights, and secondly that they are responsible for the donor's insurance for 1 year. That is one thing which they have to notarize. Second is that altruistic donation, this is not mandatory. What I have written, the second line, that this is what I practice, that donor should write it on a notarized document that this is an altruistic donation and I am waiving off all my rights. So this is one practice which I do, but it is definitely, I've gone through the papers, it is definitely not mandatory. The amendment which was done in 10th October 22, that said that magistrate is not mandatory.
This is something which really I was not knowing. So now first class judicial magistrate and metropolitan magistrates permissions are not required regarding the what you call custody of the child after the birth.
They have tried to make this easy. That was not mandatory.
It's not mandatory, ne? Now magistrate first class.
Definitely not. I can share. I will share, sir, this also.
Please, if you can do, it will be helpful.
Yes, sir. I will do that.
Yeah.
Okay. Next is I'll just write down क्या मुझे लिखना है. एक था वो insurance वाला, and one is amendment number 10-10-10 वाला. Okay, 10-10.
That's a great thing. Great.
Affidavits are also required for transfer of gametes. Okay, that we all know that transference is to be done only after we have applied to the national portal, and for that national portal application you have to first give affidavits and only then the application will be taken up. Okay. When can PGTs be done? If there is any known pre-existing heritable disease, and there is a very safe line for us that when it is medically indicated. So you can use, if you have to use the PGT facility, you can use. But of course, it is not, it is very, very clear, time and again they have mentioned, you cannot do sex selection and you cannot change the genetic constitution of the embryo. That is also safeguarded now. So about the marital status. Marital couples who can avail the services. So the ones who have been married for more than 1 year, they can be the commissioning couple. Hindu male with second wife is not acceptable because it is not legal unless the first wife divorces, according to Hindu Marriage Act. Even if the Muslim couples are there and they have their second wife, still we do need a marriage certificate from them also. Single men cannot take the treatment facility, any treatment facility, nothing there for single men. For women, a lot of facilities are there, but आदमियों की तो बेचारों की
लग गई है.
सिर्फ वो आप अपने सीमन फ्रीज करा के रख सकते हैं एंड वेट फॉर द राइट पार्टनर. किसी समय तो मिलेगी, कभी तो मिलेगी, कहीं तो मिलेगी. Unmarried female above the age of 21 can avail ART services. She has, to, of course, to supposed to be an Indian and or NRI. Then only she can do the social freezing. Any female who's more than 21 can take any treatment till the 50 years age, even if she's not married. But the never married woman cannot take surrogacy services. Married couple only can take surrogacy services. Widows and divorcee can get surrogacy services with self-gametes only. Can live-in and LGBTQ plus can apply as intending couples? No, because they are not married according to the Indian law. As yet, Indian law does not accept them as a married couple. For the adoption also, they are not eligible, and also for this. I had rechecked this with one of my advocate friends in Uttarakhand High Court. This is the same format which I had, which it had circulated in the group also. These are the standard paperwork which are required. For self-cycle, age proof is a good idea, and Aadhaar card is the best thing for that. Marriage proof, I get a small on stamp paper, I get a marriage certificate done for all of them. Form 6 is the form which I'll just mention it one by one. Form 6 is the form which says, which is the basically standard form, which says that the couple is wanting ART services. The Form 7 is used for insemination. Now, this is insemination for IUI, as well as with husband sample, as well as IUI with insemination for IVF too. And Form 9 is the form which gives consent for the freezing of the embryos. And Form 12 is the consent which gives the consent for oocyte retrieval. So that is for the self cycle. Now in DO cycle, again, same, the age proof and marriage proof the couple has to provide, but the forms, and the Form 6 is the standard form. But here the DO cycle depends. If it's the husband's semen sample which you are taking for insemination, then Form 7. And if it is the donor sample which you are using for insemination, then it is Form 8. Form 9 is the same form which says that you are ready to get your embryos frozen. And this couple has to give an affidavit that they are ready for the insurance for the donor. So that affidavit is there at the bank, and the bank's copy, ideally, ART clinic should keep. So this is the format which I have given to be maintained by ART clinics. For donor cycles, that is, egg donor has come. For that donor, you have to have a document which proves her age. And because her age has to be between 23 to 35, again, our Aadhaar card would do. The insurance copy which you are getting from the bank, you should save. The Form 14A. Now this Form 14A is what? It is provided by the bank, which tells you when did they recruit and who's the, basically it is routing from the bank. So that is a proof that it has been routed from a bank, which bank it has come from. Then the Form 13 is the form which the donor is to sign for her consent to be a donor. Form 12 is the form for oocyte retrieval. This again, you have to take from the sign, get a sign from the donor. And lastly, Form 14B is the form which says that what all embryos formed by this donor cycle, you have to provide. As a clinic, you have to provide this information to the ART bank. So that is why I've written two. One copy you have to keep, and one copy you have to provide to the ART bank. Next is ART bank, what all documents they need to maintain for donor sperms. So for donor sperms, they need to maintain a Form 14, That's a very simple form which says that what is the sample ID, when did they collect, when did they get the supply, at what date was done, quarantine period and all is clarified through that. And that form also mentions the name of the ART clinic to which they have provided their semen sample. And they should not mention the name of the patient on this form. If at all you have to mention something, then it should be the Aadhaar number which should be displayed in this form. And now I realize that Aadhaar number also should not be the complete Aadhaar number. It has to be last 4 digits of the Aadhaar number. Then form 15 is the consent form given by the sperm donor that he is ready to donate his sperm. So it's a very simple document for sperm donation. But what we sometimes forget is the copy of Form 8 or Form 14B. What is Form 8? Form 8 is the consent of the couple who has accepted the semen sample for IUI or else for IVF. And 14B is the details of those embryos which are formed by the donor sample. So this copy is to be provided by the clinic to the bank. Now, donor IUI cycle, the Form 8 is to be filled by the clinic, and 2 copies are to be made. 1 copy we keep as a clinic and 1 copy we give to the bank for their information. And Form 14 is the copy which you are getting, the clinic is getting from the bank, which specifies that what date the sample was taken, when was the collection done, and when was it released. Next is ART bank for egg donation. What all forms do we need to make for egg donations? Again, the age proof and investigation proof. Insurance is very, very important, which is to be maintained by the bank, ensure that it is done. Affidavit, again, it is to be made by the couple and it is to be notarized. Form 14A, 13, 14B, all this is the job of the clinic to provide to the ART bank if they have used the egg donors through this ART bank. So that's the whole list which the rules have mentioned.
Super.
And I have, this is the SOP which I follow. I just thought that this is some extra work, but I'll just enumerate why I do two, three things extra. So this is the standard paperwork which is there. And I ensure that I get the Aadhaar number of husband and wife self-attested. And I always give them a handout, the information of the procedure. This is one paperwork which I additionally do so that they should know before giving their consent, a pakka document that I have provided them with the information. So that they do not deny about the information that they have been provided. Forms, other thing is anesthesia consent and all we all take. That is nothing new. That is just for my staff. And I also take ET consents. For every FET, ET, I take another consent every time. So this is, it was there earlier in the ICMR guidelines, but it is not there in the present guidelines, but I have continued my old practice. The one more thing extra which I am doing is I always take a handwritten consent. This is not mentioned everywhere, but I feel that it is a very good threat to the couple so that they should not deny it later on. So always I make them write in their own language. If there is a couple, I get a lot of Punjabi patients. So I have got a format in Punjabi as well as Hindi as well as English. Whosoever language they understand better, I make them write in their language that it is a donation and it is applicable and they are the ones, or isme koi guarantee nahi hai, bachcha hoga ki nahi hoga, everything is mentioned there. So I think it feels safest to me. And mostly I get questions. If I get questions from the couple is only when they are giving the handwritten consent. All those forms, they are just signing off blindly. But they do ask after this sometimes. And very rude to them at that time, that it is okay if you want to sign it, you can sign, because donors is one thing which I strongly feel are going to be a real pain in the neck in our future. You never know when the paternities, who that female is getting as a husband. These things are going to rise with time. On paper, they can produce anything, but later on, the questionable paternities would be there. And that will become very difficult for all of us 20 years down the line. How can we prove our innocence? So we should have this document. It is a safeguard, additional safeguard to all of us. So that's the major thing. And another is the registers which are to be maintained. I have missed writing that logbooks. As registrar, I've written form 1414A, the red one. Form 1414A, 14B, oath of secrecy, and MOU with ART banks. So these are the registers which are to be maintained, but I also maintain a logbook too, which I missed writing here. So this is not something which is mandatory at all. It is not asked by the government, but this is my standard practice. I think that's it. Baki sab same. Okay, Aadhaar number, as we now, I don't think there is much left. I'm just going fast now. No embryo donation is allowed now, and it can be only donor embryos as a fresh recruit, a fresh egg donor, a fresh sperm donor, and only then you can make a donor embryo and then use it. Grievance handling is one more section which I don't know, as a clinician, I don't think that this is a very, very important section, but as an appropriate authority, I am seeing that they are finding a lot of interest in this grievance handling. So it is my suggestion to all of us that we should just maintain a register at our reception, and that form 5, which is there in the rules, it is to be displayed in our walls, so that whosoever is having any grievance, let them write it down. And it is a good idea to let 1 or 2 grievances written and you have closed them. It is very good practice to show to the inspection team. Maintenance of the records. For surrogacy, for 25 years you have to maintain, and for otherwise all of the other services like oocyte sperms, eggs, embryos, for 10 years we need to maintain all the records. Or if there are any legal proceedings, then it is to be maintained till the disposal of final proceedings. If we close our bank or clinic, then all the database is to be transferred to the central registry. I still don't have an answer to this, but I'm hoping when the registry forms, then these things will be clear with time. Single women, we know it is to be Indian. Egg donors as well as surrogates have to have insurance done. Egg donation concept. Okay, so I think that since now the egg donation has become altruistic, so with how to lure the egg donors, probably with time, we will get advertisements like, you know, you got to be a blood donor. It's a very good thing. It's a very रक्तदान सबसे बड़ा दान. तो probably आने वाले time पे the things will come. अंडदान सबसे बड़ा दान, आपके जाने के बाद में भी आपकी धरती पर आपका अंश रह जाएगा. Stuff like that will come. So I'm waiting for an Indian movie which will glamorize this thing, and then things might become little easy for us, because we are facing a lot of crunch of donors these days. The transfer of gametes within or outside of India are prohibited except for transfer of women. Okay, all this I have covered. Oocyte freezing. Any lady above 21 can do oocyte egg donation till the age of 35. I think all of this we have covered. Live-in relationships are not allowed because they are not married. A workaround is that the female can go through ART, go through the ART clinic as single female, and the partner can go through the ART bank as a donor semen, and then they can get their ART services. But the thing is that here the baby will have legal right only on the mother, and this father will have to relinquish its rights in a living.
But female should be married anyway. Yeah?
No. I'm talking about in live-in relationship, a single woman can get ART services. How? she will take the partner as a sperm donor through the bank. ऐसा तो सर बहुत होने वाला है. आदमियों के शायद मजे आ जाएंगे, फिर उनको तो बच्चों की जिम्मेदारी लेनी नहीं है फिर. No tension.
कुछ तो फेवरेबल.
Okay, so now there is a female. The situation is there is a female who's 38 years old. She's hysterectomized and she's wanting surrogacy services. So according to age, she can get the service. But the thing is that she's applied for surrogacy, and people there. This question has come up in the has been rounding quite a lot, that if she has applied for surrogacy, we cannot do her pickup, because we can do her pickup only when her approval is given for surrogacy. Only then can we do it. So this is something which I think is not right. But the thing is that right now, things which have happened like this, the court has given them permission, that their age is passing off. She's already 38. After another year, till the time the surrogacy services will be made available for her, she will not be eligible. She will not be having good eggs then probably. So do make her embryos and let it be frozen. But this is the problem which is going on right now. A patient is there who's having azoospermic husband, and she did not get pregnant with donor IUI. And she is having financial issues, and she wants to share her egg for the cost. For altruistic donation, she says that I will donate my egg. My cycle will be paid by someone else, the couple who wants my egg. So she is ready to be an altruistic donor. The only thing is that she wants a few share of those embryos for her own insertion. And she's doing it only once in her life. So, and that same cycle, it is only transfer for her only. The couple is to be transferred later on. So can she do it? But she cannot do it. Why? Because here the embryos are mixed for two persons. The embryos are shared to two persons. So this is not allowed. So if she has to get it done, she can be a donor to that couple once. And then later on in second cycle, she can take the sperms from the other person and be a donor, be a ART services availer. But and that couple can give financial support to her, but it is not possible for her. Something like this we all probably practice, but now we cannot practice. So this is one thing which I thought that we should discuss here. Single woman, 48 years old, is she eligible for ART services? Because as an age, till 50, you are eligible. But the problem is she needs a donor egg. She cannot, at the age of 48, she will not be having her own good eggs. So donor semen, it is possible that she can use since she is single. Yes, because 48 years, she's taking donor egg also. That is also possible because the transfer is happening in her own womb. So it is possible. But surrogacy, she cannot do because it is not her own gamete here. Because even if she's single and she is eligible to take a donor semen sample, but the problem is it is not her own egg. So she cannot avail surrogacy. Also in surrogacy, the age limit is very, very different from all of it. It is 35 to 45. So she's crossed 45 age. For surrogacy, married till 50, you can do it. But as a single, you can do it only between 35 to 45. So there is a couple who's same sex and they want surrogacy services, 2 females or 2 males. But no, they cannot do it because Surrogacy Act mentions, this is the section 2H. Today only I had written all this because this was asked in one of our verdict group only, that this section mentions that the couple means legally married Indian man and woman above the age of 21 and 18 respectively. This is the line which is mentioned. How many times a surrogate is allowed? Only one pregnancy, only one embryo at a time, maximum 3 in special situations, and maximum 3 ET attempts. MTP is allowed if it is indicated. Advertisement is not allowed for surrogacy services, not allowed for sex selective purposes. And for IVF services, there is no restriction. We can do advertisements for things like egg donation is like blood donation. You can give new life, etc., etc. But there should not be any commercialization on gamete donation because it has to be altruistic. Now, there is a male of 56 years old and a female of 42, and their son has committed suicide. Can we do IVF? No, because the husband's age is higher. The female age is also high. Probably her eggs are not good. So it would not allow an pregnancy for her. So can we do an even IUI with some way? No, because age is out more. Anonymity is no more important and confidentiality is to be maintained. Even in the consent of gamete donors, it is said that their personal identity will not be disclosed to the recipient or to the child. Surrogate consent workup. I'll just rapidly go through this. The surrogate has to give a consent that the intending couple and the women will be having all the rights in case of death. It is very nice thing which has come up now in this surrogacy consent workup is that in case the couple dies, then who will get the child? If that person is also not there, then who will be the next? So at least there are two more persons after the couple. And in case the couple gets separated in between, not the death, but if they get separated, then of the two, who will get the child? All that is mentioned now in the consent form. So that is a very good thing which has come up in surrogate consent form. And tests of both the couples as well as for the surrogate is to be done just before the transfer. The test, I mean the infection profile. The surrogate does have a right of MTP, but only if there is any complication and it is advised by the doctor. This is one thing by which the surrogate can blackmail the couple. So it is only if it is advised by the doctor. Form 2 by the surrogate for her agreement is to be filled. If in that form it is also mentioned that there should not be any intercourse during the preparation period. It is also mentioned that there should not be any IV drug usage. It is also mentioned that they will not have any right on the children. It is also mentioned that they have never had a surrogacy earlier. All safeguards are there. She cannot be asked for sex determination by the couple. That is also mentioned. She cannot disclose the seeking party identity. That is also a very nice thing. Even to her own family members or other people, she cannot disclose who is the commissioning couple, even if she knows them. In case of the death of the seekers, 2 more names have to be given. And in case of separation, it is pre-decided that who will get the child. Can any walk-in become a female donor? Yes, it is routed through the bank and it is no mandatory gain, no monetary gain now. The clinics are not the ones who will be buying the insurance. It is the bank which will ensure that they buy the insurance. And it is ultimately the commissioning couple. Of course, we can, as a bank, facilitate it. Same lady, can she donate again? It is not clear, but probably no. Okay, so I did find this. This is the addition that I made today. Actually, it is no. The lady cannot donate again because ART clause 27.4 says that the donor donates only once in her lifetime. And the section 27.5 says that the unused eggs of hers are to be preserved for the use only on the same recipient. Can a fertility specialist from level 1 do the stimulation and send? We have done that again. We can probably do it. And there is no clear answer to it as yet. Can we do PISA, TISA, TC? No, only with our surgeon friend that we can do it. There is one thing which I read somewhere. I do not authenticate it, but I found this interesting. So I brought it here, that the NMC says that the percutaneous methods, percutaneous aspirations can be done by MBBS all MBBS people. So this PISA is also percutaneous aspiration only. So maybe this one clause can be exploited somewhere later on by the ART specialists. But of course, it is not for TISA. Where the incision is there, it is not applicable. But needle aspiration is. Single woman, 23 years, can she use surrogacy with her own gametes? No, because one is that surrogacy age is 35 to 45. The second thing is it has to be, the surrogate has to be ever married. She can be widow or divorcee, but she cannot be single. It is only for married couple between this to this age. Now there is a wife in coma for 3 years and she's 31 years old and the husband wants her oocyte retrieval. He's scared that I can lose my wife and she's still alive. Why can't her eggs be frozen for me and embryos made, and I will use it in future with maybe my new wife or by surrogate or something. So can we do it? But as law, we cannot do it because the oocyte retrieval consent is to be given by the female. So although gamete freezing is allowed, Form 10 also requires the consent. The Form 10 says that her oocyte freezing can be done, but only if she gives her consent. So if the person who is in coma, so you cannot do it. Also, the surrogacy services are not there for single man. So again, the clause would not be applicable for him. Poor husband. ये भी एक हिंदी पिक्चर इस पे भी बनेगी. Couples second marriage of both. First marriage, husband has 2 issues. The wife does not have an issue. Now the lady has been 35 years and is having absent uterus or Asherman's, and she wants surrogacy services. So since the husband has 2 issues, it was thought that the lady cannot avail the surrogacy services because the husband has it. But there is a workaround that as a couple, they do not have an issue. So they can apply to the state boards for permission. There is a couple who are divorced after getting an IVF services. Now the lady wants embryo transfer and husband is okay with it. You go ahead as a single woman. So can we do it? But at the time of freezing, the consent was taken and the section was there about the death, whom to hand over, but the section was not there about the divorce. So it is something like a single mother with a known donor, but embryos here are being made earlier. So since the embryo is the property of both the partners, so we cannot insert this, and wife can get it done only of the court's order, even though the partner consent is there. Ideally during divorce settlement, now this is very important. In future for divorce settlement, there are a lot of issues, discussion going out around divorce right now, that in these forms also the divorce section should be included. And in all divorces in coming years in India will probably always mention something about the ART related to ART services also. What will happen? Because that is also one property which both of them are carrying together. It's not only a plot or a bank balance, it is also the baby which they have probably made. Couples in US, they want to transfer their embryos to India to donate to their relatives. Since no import is allowed, they cannot. Export is also only by permission. Transfer is also by permission. And also there is no embryo donation which is allowed. So they cannot do it. So these days, the semen samples are usually moving around with 10 to 14,000 per sample with 2 vials. So supposing you've got 2 vials and now your patient has got pregnant. So what should you do? The second sample, what should you do with the second sample? You have to discard the second sample and inform the bank that the patient has got pregnant. If the patient is not pregnant, then you can use the same sample for the same patient again. There is a couple for artificial insemination and trying for DIUI. And you have received 2 vials from the bank for single-time donor. 1 vial was used and 1 was left. The patient did not conceive. Can you use it again? Yes, you can use it. Can you use it for another recipient? If you want to use it with this couple, then you cannot use. But yes, if another donor for the first patient, then you can use this donor for the second recipient also. So can we get another sample from the first? Yes, you can get. If the result was negative, you can get. I think that's the end of it. Can we take frozen eggs from the ART banks? No, we cannot. The ART banks cannot do pickups. The pathology lab should not wash the samples or give to the labs. The level 1 or 2 clinic A is collecting the sample and sending it to the clinic B. That is also not allowed. Clinic A stimulating the patient, sending it to B, again not allowed. Gamete sharing not allowed. Embryo sharing not allowed. Repeat transfers. If the age limit has crossed, you cannot transfer. Consents on mails and on phones, try to avoid them. This third-party reproduction is going to be something like an organ donation rules. So more documentations will be linked. And the counseling, I have not yet started this, but probably in future we will have to take video consents and save them too. In India at present, doctors mostly spend time in counseling and patients are not satisfied with counselors. So more and more counseling part is going to be important, and we will probably have to train our counselors for this video consent part. And that should be in future a very important thing to be done by the counselors. Multiple donations are to be controlled. National registry setup will have more frequent data uploading. Biometrics, etc., might come in future softwares. The video consents might come in future softwares. This will check the under-the-table sharing practices. The cost of cycles will go up definitely. ART banks, semen samples are already 10 times costly. The fancy promotion calls are going to come, like Andadan, like army is calling, humanity is calling, your race is calling, something like this will come up. New laws are regarding more data management. Credibility at the World Forum will improve with all of this, because we will have better data to share. Our better results will scale up ourselves on international forums. One thing which I want to say sadly is that government sympathy is not there with us. That is the sad part. Somehow I went through many videos before this presentation, and there was one video in which Mr. Madan Gopal, he was the undersecretary at that time when the laws were being formed, the rules were being formed. So whatever his views were, whatever he shared, what were his thoughts, that clearly tells us that this is not at all, the ART services provision is not their priority, because they feel, the government feels that India is already bloating with population and procreation rights are not very important priorities for them. So it is going to be some long time before they'll realize that fertility services are very important. There are many countries in which negative growths have started. And even if in our country, all of us have felt that the male fertility is really increased. Infertility has increased leaps and bounds.
Unfortunately, our government do not believe in enhancing the satisfactory index, the satisfaction index, I would say, of the citizen, rather than they are focusing on something, many things else, rather than the citizens to be satisfied.
True that, sir. True that. So one thing I would say, that gynecologists are a very compliant and a very white-collared lot. We could not probably have done these very stringent laws of like PCPNDT with people like orthopedicians or pediatricians. And I feel that they are a much stronger lobby than what we have been. But over the years, PCPNDT even has mellowed down. It has now become bailable. Earlier, it was unbailable. So CA still is not implemented in most of the states, just because there is a stringent, very strong resistance from the doctors. But gynecologists have not put up that much resistance for PCPNDT. And since the basic infrastructure was made, for government, it was very easy to lay down this ART rules and regulations. So we have to be aware of the filling of forms, the education of masses. The doctors also need all the education, who all are to be allowed for treatment and who all are not allowed. And we have to be wary of third-party reproductions, because in future we will be harassed. and we have to ensure the documentations. Punishment penalties are very bad. Punishment up to 5 to 10 years and 20 to 25 lakhs is there. And whoever is contravenes, there are many clauses like 32.3 and this and that. It is cognizable offense, but it is bailable, and no court can take cognizance without the complaint of board. So luckily, all the boards are having some doctors in it. In our state, I am part of the board, so I know that we in our state, I don't see any strong seeing anywhere. I have seen them being facilitative. And even if the board also recommends, still the magistrate also has to endorse it by a metropolitan magistrate or a judicial magistrate. Without that, nobody can reach to a ART clinic for imprisonment or jail or whatever. Whenever the state board processes will start, then online submission will start. The procedure will be undertaken. Outcome of the procedures as well as complications we need to report. This is the last slide, and which says that this address, I recently 3-4 days ago got this phone number, so I added it here. Miss Richa Saxena is the concerned person in Health Ministry who sends it to the Health Minister for final approval. So her team can be approached through this phone number and this email ID of Richa Saxena. And as an appropriate authorities, I would conclude we need to iron out all the controversies and ease the penalties only for ethical issues rather than clerical errors. Thank you so much.
Thank you so much. That was excellent. Really, I loved it. Such a exhaustive information in very simplified way, analytical way. I think the people, whosoever I have heard Anupama, I will not name. They are purely commercialized people, and the only aim of them is to make our community frightened and fetch. I'm sorry to say, fetch money out of it by frightening them. You have made it very simple, and your every word is important and authentic because you are into the system as appropriate authority. So thank you very much. Really, words are very coming short to, show that how helpful it was. Now, my couple of my request. First, you please go through the questions. So if you think that any questions are from the chat, any questions remain unanswered, I think you have covered everything. But still, please go through the chat box.
I will do that.
And, yeah. So first, let us finish that.
Okay, so is there any specific definition of life science? Do BMS, BHMS, BDS can be considered as life science? I had asked this to ICMR people, and BMS, BHMS, they denied. BDS, I am not aware of, but I don't think that that is also covered in life sciences, unfortunately. My mind says that it should be covered, but they probably recognize this BSc degree with stuff, with subjects that they take as eligible for life sciences. After applying and submitting all documents for level 2 at the state appropriate authority, if they have not come for inspection even 1 month after applying, are you eligible to practice and do all procedures or need to wait for registration to come through? So Nishtila, we have already answered this. And,
so please don't take the questions which are you already answered or covered in your presentation.
Oh, okay, sir.
To save the time.
No inspection has happened for last 1.5 years. In my region, authority is not yet formed. It's okay. You be comfortable and continue your practice. Your job was application. Your job is not inspection. So let the inspectors come and then inspect you and then give you a registration. Right now, you know what, the pressure is there on the inspection teams to finish their jobs. It is not on you. Don't worry. Please share authorized training center names for the reproductive medicine. I don't know the exact detail, but there are not many. There are just probably 20 of them right now. But very soon the NMC will release these names. Can you share the list of centers which are eligible for embryology fellowship? Same for that also. Please tell about AID samples. According to new ART law, single sample for one patient from bank should be obtained. If yes, then one sample will cost more as compared. Yes, yes. That is a very, very big problem. Earlier, we used to get a sample of 700-800. And now we are getting a sample for 10,000 or something. And the bank people, the good thing they are doing is by giving 10,000, they are providing 2 or 3 samples from the same person, so that even if in one IUI the patient doesn't get pregnant, you can at least attempt 2-3 more with the same sample. But if the patient gets pregnant, make sure that you discard that semen sample. You cannot use it for some other couple. If a IVF center is new building, which is still under construction, going for completion till December, can we apply now and the checklist to be followed? You know what? I'll share my personal experience. Around 8 years back, when I had applied for my registration, my stuff had come, my building was done, everything was done. So I thought that I should call the inspection team so that my pickups can be done. But unfortunately, although everything had come, my OPD construction was also going on simultaneously. Lab was also late, but the boxes were not removed from the instruments were not removed out of the boxes. I mean to say the installation of the machine was not done, although it was there in my setup. Everything was there, the bill was there, the payment was there, but they rejected my application. They said that we will come back once your thing is finished. So the appropriate authorities can be really strict at times. So my suggestion is finish off, let it be laid, and then only call them. It might be delayed 15 days or month, but calling them a second time was a real problem for me. So that is my friendly suggestion. No inspection since, okay. What else?
I think you have covered everything. I think no point left.
Okay. Thank you, sir.
So my another 2 requests. One, because you have beautifully categorized what consents are required and what paperwork is needed. So we will request, because we will request you to make a PDF of each and maybe print out. We are ready to pay whatever charges are there, but it is going to be greatly useful, I tell you. For the same information which you are giving free of charge, it is the commercial people, they are charging 2 lakh rupees, 2 lakhs of rupees, 2 lakhs of rupees. Believe me, I have asked them, just told them that please verify that whatever documentation we are maintaining, you please authenticate, okay, it is done as per the provision of law. They ask for 2 lakh rupees for the same. So we are really, really, really grateful, and still will become more grateful if you can share the PDF of each bunch for different sections. Suppose for donor oocytes, for surrogate, for recipient, for normal cycle, these that. So if you make a bunch of the papers, and if you can provide either digitally or the PDF printed form, we are ready to pay the charges for that. You
No,
can
sir,
employ you can employ
you don't
one
have
of the
to say
person.
that. I have already given the list. The only thing is to compile it and make it in a PDF format. I'm not very good at it, but I'll ask one of my hospital people, the ones who will take care of it. And with after some time, I will do that also, sir. Right now,
Yeah.
you know, there is some problem at my house, so I'm not too much. It'll take a lot of time. But speaking is much easier rather than compiling for me.
Yeah. That's the reason I know. But then please keep this in mind. Keep this
Yes,
in mind.
definitely, sir. Definitely. I will do that 100%. Thank you, everyone, for your kind words. Thank you so much.
And final last request. Can you give the mail address of important central body or something where we can communicate? The official mail address is of the ART.
मेरी प्रेजेंटेशन में भी थे और जो मैंने वर्डिक्ट में दी थी उसमें भी थे और हमारे ग्रुप में वो सर्कुलेट भी हो चुका है. I will resend it. That is not a problem.
Please do it.
मैं दोबारा भेज दूंगी. That is not a problem. एक लाइन की है. So insurance एक ही ID भी हो गई और एक amendment. ये सब मैं सब भेज दूंगी.
And which is the website or where we can get the latest information about the recent rules and updated rules?
सर ये सेम साइट है हमारी artsurrogacy.gov.in वाली, एंड पे बहुत सारे हैं. एक्चुअली मुझे टाइम लगा वो एक एक करके खोल के सारे पढ़े थे. मैंने तो वर्डिक्ट कॉन्फ्रेंस से पहले सारे पढ़ लिए थे, तो एक एक करके वो सारे पढ़े थे. तो ये अमेंडमेंट्स वगैरह जो मैंने ऐड किए वो सब उसी में से निकाले हुए मैंने.
ठीक है, तो वो वेबसाइट पे अपडेटेड ध्यान रखेंगे तो सब अपडेटेड रूल्स मिल जाएंगे.
एग्जैक्टली सर. हाँ, मैं उसमें से वो अमेंडमेंट निकाल के भेज दूंगी ग्रुप में, लेकिन सब कुछ मैंने तो वहीं से ही लिया हुआ है. मैंने कुछ भी अपने से कुछ नहीं किया हुआ है.
Great Anupama, really I loved it.
Sir, coming from you.
Such a yeah.
Sir, I would again use this platform to tell everyone that there are very few men like Dr. Koradia who are so selfless and who are actually just at this stage of life that they are only into giving and giving and giving. And I just want to follow his path. And I wish all of us rest of us who are here should do the same. Thank you, sir.
Anybody wants to say anything, please feel free to unmute yourself.
सब बोर हो चुके हैं सर, अब हम क्लोज.
नहीं, बिल्कुल ऐसा कुछ नहीं है. बहुत मजा आया.
टॉपिक था ये सर. मुझे जिंदगी में नहीं पता था ये एप्रोप्रिएट अथॉरिटी बना दिया, तो मुझे ये रूल रेगुलेशन पढ़ने पड़ गए. नहीं तो मैंने जिंदगी में कभी कोई लीगल चीज पढ़ी नहीं. मुझे बहुत ही मुश्किल लगती.
Ma'am, thank you so much, ma'am. Sir and ma'am, thank you so much. It's a great presentation. I came to know so many new points regarding the rules. Thank you so much, sir and ma'am.
Thank you. Okay, so can we end?
Yes, sir.
Yes, I think.